Do you have one of these at home? It's called a massage stick. My name is Dr. Aaron Moreland. I'm with Vallejo Health and Wellness Center in Eden Prairie. And I want to talk to you about this today because recently I had done a video on knee pain and just talking about maybe it's not coming from the knee itself, maybe it's a soft tissue around. And then I also did a video showing a kind of a self-test you can do to see how healthy your knees are. And that test, one of them was to do a squat. Well, I had a patient come in and she said, I tried to do that squat test that you showed in that video. And she said as she got down about halfway into a squat, she said that she started having pain, but it was right at the bottom, okay? Right at the bottom of where there's a tendon that attaches there. And there's a bursa that's there as well. And so that's really not the knee joint at all. So we talked about that, and so then I started doing an exam on her, and I could move her knee a lot further than she could move her knee. And so then I started feeling around in her quadriceps and found that she had lots of trigger points in the quadriceps, very tender, especially touching this lateral side of her leg. And I talked to her about what she could do for that. One is using a massage stick on her. She's got really tight muscles in here. When those muscles fire, when she starts squatting down, she starts getting pain in here because that pain is shooting through that quadricep. And like I said, I could move her knee a lot further than she could, so it really told me that the knees, that the muscles are somewhat of a restrictive force that's stopping that knee from moving the way it's supposed to. So I talked to her about using this. This again is called a massage stick. Now a person can use a rolling pin if you have a rolling pin at home. And what I talked about was massaging that out, okay, rolling that out. Now, I think a lot of times we think, well, if there's a trigger point there, if it's something's going on there, well, I'm just going to crush that. I'm going to get on that thing and I'm just going to really dig into that. It's actually probably going to irritate it. And I like to use this thing more of a fascia massage. And so if you're not familiar with the term fascia, what fascia is, it's this outer layer of the muscles that actually connects to everything, connects over our organs, and it all connects to each other. So if I have an issue here, my quadricep, that quadricep fascia, it also is connected all the way up into my shoulder. So I could be dealing with a shoulder issue related to my quadricep and not know it. And so when I tell people to do this, using the massage stick to massage things out, it's pretty light actually. I can't necessarily show you exactly what kind of force I'm using, but it's pretty light pressure, and I just massage fairly quickly, more like friction, and I can do the whole leg that way. I can do my back this way, so I can do a lot of things with this massage stick. I even see using it for the forearm. A lot of people get wrist pain, they get pain into the hand, and a lot of times it can be coming from the forearm, so I'll just do massaging of the forearm as well. So I just love this tool as a way to self-massage and to get rid of some of these issues, again, especially if they're related to fascia, which a lot of them actually are. And what can happen is if you have this problem, then it can lead to bigger problems. If she's not being able to squat down, then that knee doesn't bend the way it's supposed to. That knee starts to get unhealthy, and then a person ends up eventually having to have a knee replacement because they're not using the knee the way they're supposed to. So this is a great tool to use for self-care. So hopefully this is a helpful video. Again, my name is Dr. Aaron Moreland with Vallejo Health and Wellness Center. You have a great day. God bless.